See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
What does it look like when anyone and everyone can create a medical device?
Out in the lab, there's 3D printers and silicone molding going on, and we're working on an electronics project right now to adapt a couple toys. So there's some wires hanging out on a table with a soldering iron. So lots of different things.
MakerHealth exists to enable nurses to do the work, and it exists with principles that meet nurses where they are so that they can lead innovation programs inside of this bigger community as a creator who is a nurse.
We are a place for education and for designing and prototyping and safely experimenting, but the person that comes with the idea is the person that's then empowered to make their idea come to life.
Let's try. We're jumping into an experiment, the agreement that in the let's, right, they're not alone, let us. It's you have somebody who you're going to partner and work with on this.
It was always tell me more about it. Let's explore this. And it was never immediately shut down. And I think that's what just kept my spark going.
Visionary leaders are going to see that if we don't create these opportunities to support and advance the teams that are burning out, if we don't invest in them, they're going to continue leaving, and they will find ways to do creative, impactful work that is outside of the point of care. The moment to invest in and provide resources to support the development of frontline teams is today. Tomorrow's too late.
Welcome to See You Now. I'm Shauna Butler. Nurses have long been admired and counted upon for their ingenuity, inventiveness, and creative problem solving. We have a rich and entertaining history of rigging up medical equipment and fashioning unique setups that address a patient's illness, situation, and abilities. Throughout the COVID-19 pandemic, frontline clinicians around the world designed, fabricated, and shared novel solutions to unprecedented patient care challenges. And across the globe, nurses are searching, reinventing, and yes, hacking their supply closets using readily available materials and tools like magnets and electrician's tape, sewing machines, and soldering irons to design and assemble devices that help people recover fully and faster and increase their independence and dignity. They are do-it-yourself problem solvers, maker nurses, and part of the growing global maker movement that is making its way into health, hospitals, and wherever greater personalization and rapid prototyping improves people's lives. In this two-part episode, we meet a maker and a nurse who are growing the maker movement and community in health, seeing its impact on the mindset and skill set of health teams and patients, and serving as an attraction to and support in building thriving nursing workforces and careers.
Hi, my name's Anna Young. I'm the co-founder and CEO of MakerHealth. We build the tools that drive experiments to change healthcare. We install makerspaces at the point of care, whether that's a healthcare system or a community or a school, and enable the people closest to the problems, clinicians, to solve them.
My name is Rose Hedges, and I'm the Nursing Research and Innovation Coordinator at St. Luke's Hospital in Cedar Rapids, Iowa. I run our medical makerspace that's inside of the main level of our hospital. I help clinicians with providing them the tools and resources to bring their ideas to life. Whether we're prototyping at the point of care or in our innovation lab, we help their ideas to become tangible things that we can use to improve patient care.
MakerHealth has launched Create, which is a platform to bring prototyping tools and trainings and framework into healthcare systems. So we do this with Create Lab, which is a makerspace installed at the point of care. It's an invention space where people can come, bring any challenge to work on, and we'll create it. Create Cloud is for systems that may not have access to the physical space, but that still want to build that culture of innovation. So we send creation kits to clinicians at the hospital or at school or in any setting where there are ideas and where care is being provided. And you have all of the tools and materials needed inside of that kit to build a portfolio of projects. More recently, we've launched MakerHealth Academy. This is designed to reach clinicians where they are. We know that wherever there's a clinician, there's an idea for a way to make care better, a way to transform the way that we're reaching patients today. So MakerHealth Academy is designed for individual clinicians to have a personalized prototyping journey. As passionate as I am about the history of nursing innovation, Rose is like blows it out of the water with her just energy and enthusiasm for that too.
Our projects are endless. We have done projects from empowering a 16-year-old girl to be able to put on her makeup again after a spinal cord injury by 3D printing special hand braces, to enabling a lab technician to customize a flashlight for the back of his scanning device so he didn't have to turn on the light in the middle of the night. We have a physical makerspace in the main corridor of the hospital, and we help really anyone who works in the hospital to make their idea come to life. So I'm in the makerspace today.
When you look around, what are the types of things that are in the makerspace? What are you seeing?
Out in the lab, there's 3D printers and silicone molding going on, and we're working on an electronics project right now to adapt a couple toys. So there's some wires hanging out on a table with a soldering iron. So lots of different things.
What kind of people are there? Who's there?
Well, we have a fabrication fellow who's kind of my right-hand man that helps me with the technical side of the projects, and I bring the clinical spice, if you will. But right now, there's a NICU nurse out there working on a project to help make it a smooth transition out of an elevator when you're pushing an isolette. So there's other people that come all the time. We have technicians. We had dietary here last week working on a problem that they identified. Maintenance has been here. It's really anybody that works in the hospital can come use the space.
What about patients and family?
Yeah, some of my best days are when we get to have a patient come to the lab. Most recently, we had a patient come who was a young mother and was learning a lot of activities of daily living. And one of her problems was laying her 16-pound child down in the crib. So we customized a baby doll and made a 16-pound baby doll so she could practice that motion of laying her child down in her crib. And so she came to the lab and worked with us that day, and we did it.
Oh, interesting. So what's the specific challenge that this mom has in working with her child?
Unfortunately, she had COVID, and her baby was 3 months old when she was hospitalized, and she was with us for about 80 days. So she was just very weak. And so when she left the rehab department, she still comes back for outpatient therapy. And one of the things she was working on was just strength and upper body strength. And laying a 16-pound baby down in a crib, you have a motion of your upper arms using that weight. And she needed to practice that. And she's like, can't we make this better? I met Rose. Can't we go to the lab?
Rose, I want to jump in for this because I think one of the amazing parts of this story is this patient actually knew about the makerspace because her nurse had brought the sewing machine to the unit in order to create a custom headband for her to manage the different tubing while she was on treatment and inpatient. So she knew she had a custom device created for her that helped make her care more comfortable while she was healing and recovering. And so for her, when she left and saw a challenge in her own treatment, she's like, wait, I know I don't have to live with this. Like I can actually work with the team inside the hospital to solve it, which is just the most beautiful and inspiring collaboration and just culture of, hey, there's a challenge, let's solve it.
What are some other stories like that, Rose, that stand out?
We also had a patient who came down who was a farmer. I'm in the Midwest, right? So one of his challenges was that he wanted to be more independent, and he was very particular in wanting to be able to wear his Carhartt jacket. And Carhartts are very firm materials. And so he couldn't get his arm back the way he needed to in order to put his arm in the sleeve. So we custom made a device for him that enabled him with his left side of his body, which was his strong side, to be able to pull that sleeve over and then slide his arm in. And he was just ecstatic that he did not need to ask for help to put his jacket on. So exciting. One other story that is important to me that I want to share is we had a young patient who was here with us in the hospital, and she was really big into like watching YouTube videos on makeup putting on, and she was 16, and she wanted to be able to put on her makeup again, but she had a spinal cord injury, and so she only had gross motor movement, So she could still get her hand to her face, but she couldn't hold anything. Her fine motor skill was still kind of developing at the time. So we custom 3D printed a little band and molded it to her hand and made a magnetic interchange, and then adapted like her makeup brushes, her mascara wand, so she could still get her hand to her face, and then with the motion of her head, put her makeup on. And she just was so empowered, and the joy on her face, like bringing that back to her, was one of my best memories.
I'm smiling thinking about how undervalued and underrated the role of dignity is.
Absolutely.
And restoring the dignity of being able to take care of yourself. These types of things where we restore dignity, they're huge. They just make such a difference. So I hear your excitement and enthusiasm. How did you learn about the maker movement and then creating this fabulous, fabulous space at St. Luke's?
Well, if we go back a couple years, in 2016, I was exploring options for my doctoral project. I knew I wanted to focus on nursing, keeping nurses at the bedside. What could that be? And I wanted to kind of explore engagement opportunities, and innovation, as it still is today, is this big word that flies around healthcare. And so I put into Google, really, innovation, nursing, healthcare, engagement. And I stumbled upon this great company that was a spin out of MIT, MakerHealth. And I cold emailed them and said, I love what you're doing. Your story is incredible. I watched your TED Talk. Can we please connect? I'd love to have the opportunity to work with you guys. And that spun into hosting a CEU event. Great day. The minute during that day that I knew this is my life's work was when I had challenged the room full of nurses. We had about 60 participants. We gave them a challenge and said, here's some materials, fix the problem I identified. They all solved the challenge, and it was great. And I gave them purposely probably a little bit too much time. And what happened was they started then talking about their own challenges in nursing and then solving it. And I was like, I didn't tell them to do this. They naturally started talking about EKG patches or patients who needed a diversion to keep their IV in, and then they just started prototyping them right there on the spot. And I was like, this is it. I have to give them a space to be able to do this work. So that's really how it all started. It was incredible. And so Anna felt the palpable excitement that day, and she believed in me and reached out to us and said, are you interested in taking this one step further and continuing this work at your hospital? And before I could even check with my leadership, I was like, yes, absolutely. Whatever it takes, I'm in. I'm going to make it happen. Absolutely. I said yes without having approval. But I also knew that the leadership team I had was pretty incredible. So I went to our leadership team and I said, Carmen, I'd like to do this process where we hold mobile innovation labs. And I was working in informatics at the time. And I said, don't worry, it'll be in addition to normal duties. Can we try this? And she said, you know what? Let's go to the foundation and talk with them and see what we can do. I think this is a great idea. And she believed in us. So we started hosting pop-up labs. And that was incredible with support from Anna and her team at MakerHealth. And we very quickly realized that this was something that was so needed. People began stopping me in the hall, or they would text me or say, oh, hey, I had an idea about, or what do you think we could do about this? There was this culture that kind of started to shift from that's the way that we do it, and I know we're going to go through this process to fix it, to, hey, I think we could just fix this. Let's talk about it and find a solution right now. Or people started talking about workarounds, and then we were able to create something to fix said workaround. So over the course of about 18 months, we did pop-up labs, and I had this really big portfolio, and people were coming to me almost daily. I had about 50 to 60 projects, things that we had created during this time. And so I went back to Carmen and I said, I think we need a physical space in the hospital where we can turn these projects around faster to be able to empower people that want to talk about this and do this work. And she said, yeah, let's look into it. And again, the cycle repeated. We worked with MakerHealth, built a business proposal, went to our foundation, and our foundation said, yeah, I think this is a great idea, guys. We need to help you push this work forward. So in the fall of 2019, we opened our Makerspace Generate.
And from there, what have you seen? I was going to say, so you've got a lot of folks that are curious, interested, they're sharing ideas. you can see a shift in the language and the mindset. So now when you get that in place, where does it go from there?
We opened in November of 2019, and in
perfect timing.
March of 2020, a big thing happened. Very strange. A pandemic, right? Who could have even planned? I was very fearful when I started watching from the coast, because we're in the Midwest. I started watching from the coast. It's in the United States. It's coming our way. You hear about people getting sent home to work from home if they're not on the front lines. And what was this going to do to our lab? And I was a little bit fearful, but I reached out to Carmen and our leadership team and I said, what are we going to do here? She said, absolutely. You are essential to the working of this hospital. You have to stay open. And we did. We stayed open long hours, and we almost became a roving door of projects in and out, from the maintenance guy coming down saying, hey, we need to turn this med surg room into an ICU room, but we can't get this plaque to be able to do more wall suction in the room, to we don't know if we're going to have enough masks for our patients to wear when they're going to a radiology procedure. What can we do about that? The projects just flowed in, and it really became a space to bring a problem or an idea that you weren't quite sure what to do with. And they knew that it was a safe place to experiment on those ideas, put it right back out there in the hospital, get immediate feedback on it. And you know what? Nurses on the orthopedic floor, they hated that process. So we had to come back and we changed it, which was fine, but we could get that immediate feedback loop being right there in the central part of the hospital. So it really changed the culture to, you have an idea? Let's go to the lab. We'll fix it.
Or it sounds like maybe you could bring the lab to them, because you started out pop-up, which meant some degree of mobility. And now you have a space. So now we want to have hybrid. It's not an either or. So how does that transition happen?
So we of course have a telephone here, but they could call us or text us and say, hey, I have an idea, but I can't get away. The instant that Anna was talking about in the ICU, where we created a custom headband for some ECMO lines, was I happened to be working in the ICU that day, and one of the nurses was like, man, I just wish we had a better way to hold these lines. She needs to get up and walk, but these lines are a challenge for us. And I was like, well, what do you think we should do? She's like, well, I wish we could just sew this piece together and and I was like, I'll go get the sewing machine. So I just ran down to the lab, got the sewing machine, grabbed a couple of materials, and I have pictures of her sitting at the nurse's station sewing this band together to create it for the patient. And it really just became we know that there's people who can't get down to the lab. So we would round sometimes, like as we were saying, hey, we have this new product that one of our surgical units made, but we know that it'd be helpful for your unit. We wanted to just show you about it. Can we help facilitate you bring it to your unit as well? We also are working most recently kind of on an internship where we have a couple nursing students who are techs in our hospital that are going to kind of be the go-between for maybe nurses who can't step away from the unit, but they can be the eyes and ears and maybe hands to get some of those projects to keep moving forward and out of their brain and onto like a physical thing we can start using.
Reinventing the supply closet, right? It's so healthcare should be so personal, and it should be made to be personal. And there are tools and resources to do that. And clearly, Rose, you're showing there's a workforce that's able and ready and has ideas for how to do that too, which is so exciting.
What insight did you have that said, oh, we need to have a makerspace? So I'd love some context, like what the Little Devices Lab at MIT is, and then a little bit of that journey.
So we're within the Institute for Medical Engineering and Science. So it was almost like we brought that creative flair to the engineering and science and medicine research happening in that department. And the Little Devices Lab at MIT was interested in, and we were exploring democratizing health technology. So what does it look like when anyone and everyone can create a medical device? So at the time when this research was starting was when the maker movement was really having its moment. So the Maker Media team was hosting maker fairs around the world. We were as part of as many and all of them as we could, whether it's in Paris or Queens, New York, or Detroit, Michigan. We were there to have a conversation about what does it mean when you give tools such as, like what Rose was explaining, 3D printing, mold making, microcontrollers to people who have ideas in healthcare. Really, the seed for what is MakerHealth today started in Ocotal, Nicaragua. So we were there on a project to teach medical device innovation. And we thought we would arrive and be surrounded by MacGyver surgeons and physicians who were, using fishing line. And we did meet some really creative physicians, but what impressed us the most were the nurses who were working, whether it was a clinic, whether it was a hospital, whether it was a public health campaign, and they were creating. They constantly had things in their hands that they had made. They had made cloth glasses to cover and protect babies' eyes. They had repaired their stethoscopes with transparency slides. So like, wow, this is amazing. And we came back to the US saying at every conference we went to, like, MacGyver nurses, like, how do we talk about this more? And the Robert Wood Johnson Foundation, they were incredibly excited by that notion. They said, we want to support nurses. Can you help us think of a way to do that? So that was really collaboratively how Maker Nurse was born. And at the same time, we had in our back pocket, coming from our lab, we knew how to prototype quick and fast medical devices. And we knew these tools were being democratized. We had expedition sites in Massachusetts and Virginia and in Texas. And what we saw was that nurses were making. They were making and creating and doing it in a way that what we call stealth innovation. So there was, what Rose mentioned, the workarounds, the ideas, they were happening everywhere, but they stayed in the instance where they were happening. It may be a device that could have a reach of 1 million patients. It may be a device that could just help one patient, all incredibly exciting, but all without the legs to really scale. And at the same time, nurses would come to us and say, like, well, I have an idea. I just don't know what the first step is. We're like, we need to support this workforce. We know these tools exist. We know their ideas can come to life. So we took it on as our mission to think about, how do we make this happen? And the next logical step was, well, we put a makerspace in the hospital. And this is where, I think it's really exciting and fun for us to partner with clinicians, because for us, it was just like, hey, you find a room, you set up a lab, it's easy. And so we underestimated Then
you go and talk to health system leadership and
right.
I will quote one of my favorite nurse entrepreneurs, Diane Baker. There's no such thing as a simple solution in a complex system.
Right. So it's 100%. And I think it really was about finding those right partnerships, finding visionary nursing leaders, and finding nurses such as Rose who are like, I'm going to champion this.
And you have a lot of experience talking with nurses and health systems, health makers, really, all around the globe. For so many, it's the very first time that they've used a welding device or sewing machines in their practice. What are you seeing that's being effective in introducing a broader range of tools to problem solving in a course of an education without having to become an expert in any of the technologies?
That's critical, Shauna, because our goal is not for nurses to become engineers, but really to build what we call a prototyping literacy so that they can navigate multiple experiments and build and own the prototype and find partnerships when needed and be able to have that interdisciplinary project. So we work with 15-minute prototyping cycles to be able to introduce, like, when nurses have 15 minutes, they come in and have very pointed learning. So we do personalized learning resources based off of the idea. We know that any given nurse may not need to learn every single technology that Rose described that's in the lab. And it can be really overwhelming to walk into a room that has every single technology available. So a fabrication fellow looks at the project, scopes it out, and picks the individual stations that the nurse needs access to. And so that the targeted micro learning and cumulatively building the prototyping literacy, but not all at once, being able to say, this is the exact skill that you need for this project. And I think Dale Doherty from Maker Media said it best, where making it's a tool set and it's a mindset. So you've got the technology and the tools that you're learning and the mindset of, I can do it. This is within my wheelhouse. This is exactly what nurses need and should be doing right now. And it's important. And then having the safe place to do the experiment. I think that young nurses are really fantastic at context shifting. So being able to learn resources and then immediately see an application for how to use that. And they need permission for when and how to do that. The exciting piece that we've been building is, like, how do you teach then the diffusion strategy that goes along with this. And what does that look like? And what is the biggest impact for the creator and also for the population? So when you make a technology, there are many different ways that can become available, whether it is open access, reaching millions, or commercial product. We have a couple of different ways that we support clinicians and we support healthcare systems to learn these skills and to partner with organizations that are educating and credentialing nurses. So our Create platform includes Create Lab and Create Cloud, where resources are made available to a healthcare system. So Create Lab, you have a physical makerspace that's installed. Create Cloud is a virtual makerspace. So maybe the hospital doesn't have space to dedicate to a lab. That doesn't mean that you can't build a culture of innovation and a culture of prototyping. So how can these resources reach clinicians where they are, where the ideas are happening? And it's not always within, as you mentioned, the walls of a hospital.
At a wildfire, at a flood, at a power outage. There's so many places where that need to rapidly solve a problem in a completely different environment to what you're used to. Yeah.
So imagine Blue Apron, but for medical device prototyping. That's the heart of what Create Cloud is let's teach the frameworks for how to have these conversations and then ship you exactly the materials that you need. We've taken that a step further and said, not only are really amazing healthcare creators working everywhere, but they're individuals who may or may not be inside of an organization who wants to support this idea. So Academy is designed as a standalone training program for individual clinicians to be able to create their medical device idea. So come to MakerHealth and share what you want to work on and get access to the behind the scenes remote support, customized creation kits that include the materials to create this device, and plug into a community of creators and a community of like-minded individuals, because sometimes that's the most valuable part of anybody's innovation journey is the people you meet along the way and what you can learn from them.
Coming up in part 2 of Making Spaces.
Every makerspace is different because everybody has a different problem to solve and a different solution that they want to create.
How can we share these ideas across our system that is healthcare nationally, globally?
All parts of the healthcare system benefit from both this mindset of, I can do it, we can solve the problems, and access to these tools.
Anna Young is CEO and co-founder of MakerHealth, the parent organization of the Maker Nurse program. And at St. Luke's Hospital in Cedar Rapids, Iowa, Nurse Rose Hedges is Nursing Research and Innovation Coordinator and Manager of Generate at UnityPoint Health, an open access, hands-on medical technology and learning lab where hospital employees and patients have access to world-class tools and talent for point-of-care rapid prototyping. For See You Now, I'm Shauna Butler, and be sure to check out part 2 of this episode, Making Spaces.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.